This is the lab interpretation guide for the DestinyWell migraine profile. What kinds of things can tests tell you about your migraines? Well, they can tell you if you're deficient in nutritional factors, if you have inflammation, if there are hormones like your thyroid out of balance. Each of these can be a root cause, and when fixed, your migraines may get entirely better. Other things that are worth considering: consider testing for celiac disease at least once in your life. I've seen a number of patients who had celiac disease diagnosed, and once they went on a gluten-free diet, their headaches went away completely. So if you've not had celiac testing, consider the DestinyWell celiac screening profile. I also think it's important for everyone to check for anemia. Anemia can contribute to headaches and other problems, and so checking the anemia profile is also a good idea. We also have a migraine solution. If you've explored other choices before and you haven't gotten the results you need, consider our migraine solution program. Vitamin D, the sunshine vitamin. When you hear people talking about vitamin D, they're usually talking about 25-hydroxyvitamin D. This includes vitamin D2 and vitamin D3. The DestinyWell test measures both of these together for a total 25-hydroxyvitamin D. It's also called 25-OH vitamin D. D3 may also be synthesized as well as being extracted from animal products. It may be somewhat more active than vitamin D2 that comes from plants. Occasionally, when you read about or research vitamin D, you'll come across references to 125-hydroxy or 125-OH vitamin D. This is the activated form of vitamin D. The body adds an extra hydroxyl group to activate the vitamin D, and that's the type that's most active in the body. This factor can go up in disorders like tuberculosis or certain fungal infections, and it can be deficient and need to be replaced specifically in renal failure in conditions where the body can't make this conversion. But most of the time when you hear about 25-hydroxyvitamin D, or you just hear about people talking about vitamin D in general, they're talking about D2 and D3, which is the 25-hydroxy form. Vitamin D is of key import to many tissues in the body. It's critical for the regulation of the immune system, but almost every tissue has vitamin D receptors and needs it for adequate function. Bone is a great example of this. New bone is laid down with the help of vitamin D. It's also important to have other minerals like magnesium and zinc. But vitamin K2 is also a super important factor to be given with vitamin D. It ensures that the body uses the vitamin D and the calcium in appropriate ways, and that the calcium doesn't get laid down in places like the coronary arteries or other tissues that don't need it. Sunshine or not, people can be deficient in vitamin D. Even if you live in a sunny area, often people wear sunscreens, they aren't out during much of the day, they live in the basement, and their diet is low in vitamin D. So it's important to keep track of your vitamin D and to measure the level to know where you really are. Vitamin D is made from cholesterol in the body with exposure to sunlight. It can also be made with exposure to specific lamps or other types of sun lamps. Fish like salmon and tuna have vitamin D. Many cereals and other products are fortified with vitamin D, and it's very frequently added to milk and to some type of orange and other juices. Egg yolks, liver, and cod liver oil are also all good sources of vitamin D. At DestinyWell, we define laboratory ranges in a sophisticated way. We use the standard ranges, represented by the blue bar here, from each reference lab that does a particular test to define the lab high and the lab low. If you have thyroid test results that are too low based on the lab's formal norm, then you have a diagnosis of lab low thyroid function or hypothyroidism. Similarly, for glucose, if you have a lab high blood sugar of over 126 on 2 occasions, then you meet the formal diagnosis criteria for diabetes. That's needed to make a medical diagnosis. But at DestinyWell, we think that there can be a lot more nuance. We believe that there's often an optimal range based on what we've found going forward helps people to live the healthiest lives, to be the healthiest, and to avoid disease. We triangulate this with the medical literature, with other people's standards, with our clinical practice experience, and all the different data points we can get, so we can come up with what we believe is optimal for a particular test result. DestinyWell also In the red bars here, we'll define a destiny well high and a destiny well low. These may or may not line up exactly with a laboratory high or low, because sometimes we think that the range can be higher or lower, or that it needs to be different. And in between the optimal and the green bar and the low and the high in the red bars, we have orange zones for moderately high and moderately low. They're not quite optimal, but they're not in the high or low zone. Vitamin D ranges are a bit tricky. Vitamin D is a fat-soluble vitamin, and at extremely high levels, it does have toxicity. The normal lab range from our laboratory partner is greater than 25 nanograms per deciliter. At Destiny Well, we think the optimal vitamin D level is usually somewhere between 35 and 80. 35 is adequate for most functions in the body, and a value of around 70 to 80 is often helpful if you have immune deficiencies or if you have autoimmune diseases or other concerns like that. Values less than 25 are too low, 25 to 34 are mildly low, 81 to 100 are mildly high, but toxicity generally doesn't occur there, and over 100 is where we would draw the cutoff because we don't see much benefit, and at levels significantly higher than that, toxicity occurs. So don't get over 100 if you can help it, and try to be between 35 and 80. Ferritin is generally the best marker of iron status for most people. It is, however, also an inflammatory marker, so if you have acute or serious ongoing inflammation, sometimes it will be elevated or up in the normal range when it shouldn't be, just because it's a protein that goes up with inflammation. The laboratory reference range for ferritin is 20 nanograms per milliliter to 400 nanograms per milliliter. At Destiny Well, we think the range of 50 to 200 is optimal. Often neurologic problems and athletic performance improve when you get up over 50 to 75. Ferritin over 400 is definitely too high, and people with liver disease or iron storage problems like hemochromatosis, a genetic condition where too much iron is saved by the body and it causes toxicity in the liver and heart and other things, those people, or people with serious liver disease, will often have ferritin up in the range of 800 or 1,000 or more. The 200 to 400 range is moderately high, 20 to 49 is moderately low, and less than 20 is definitely low and usually indicates iron deficiency. Some of the main sources of iron deficiency, as manifested by low ferritin, are being a vegetarian and not taking any iron in your diet, being a junketarian, even if you do eat some meat, if you mostly eat junk food like French fries and potato chips and white bread, you're not going to get enough iron. And GI blood loss. You can lose blood from the stomach or the colon or any place in between, a drop at a time, and then you won't necessarily see it, but you can get to be anemic from that. When you have insufficient iron, resulting in iron deficiency, you can have a number of symptoms. One of the most common is fatigue and decreased exercise tolerance. People are lethargic. They also have immune system dysfunction and get more frequent infections. The nervous system gets more twitchy, and they feel cold more often. They have less resistance to being cold. They have impaired learning and brain function. All of these things can happen together or just a single one. C-reactive protein is a protein that goes up when there's inflammation in the blood. Not only is it a marker of inflammation, but the CRP itself is actually a damaging factor. When we look for low levels of chronic inflammation rather than high levels of inflammation, we look at a test called high-sensitivity C-reactive protein that brings out the details of what happens with low-grade inflammation. Regular C-reactive protein will go way up with diseases like rheumatoid arthritis, lupus, and chronic infections. But high-sensitivity C-reactive protein has a lower set value, and those ranges are more looking for chronic low-grade inflammation that's associated with everything from increased cancer risk to increased risk of Alzheimer's to more migraines to more depression, and it's especially useful in evaluating for cardiovascular disease. The reference range from our laboratory partner is 0 to 4, with values over 4 being abnormal. We find at Destiny Well the optimal range is less than 1, and many cardiovascular protocols use this cutoff as well. Values of 1.1 to 3.0 are mildly elevated, and values of over 3 are definitely associated with increased cardiovascular and other risk. This is one of my favorite diagrams. It shows the feedback loop and how the brain and the thyroid work together and how they talk to each other. A brain area called the hypothalamus puts out a hormone called TRH, or thyrotropin releasing hormone. That goes down to the anterior pituitary, which is also in the brain. The pituitary gland is where the TSH, or thyroid stimulating hormone, is made. Thyroid stimulating hormone does exactly what it says. It stimulates the thyroid to make thyroid hormone. Most of what it puts out is T4, but about 7% of its output is active T3 hormone. Then, when the T3, T4 hormone increases, it gets into balance, and things like low body temperature go back up to normal, heart rate, blood pressure, bowel function, many things that were out of balance normalize when the T3 and the T4 concentrations are normal. When the brain sees adequate or increased amounts of T3 and T4, then it stops sending out extra signal of TSH, and the TSH level goes down. So when everything's working normally, that's how the thyroid and the brain talk to each other and how they regulate each other. This is where it gets tricky. Most doctors and most patients assume that all thyroid problems happen at the level of the thyroid gland. When a thyroid problem, either too high or too low, either hyper or hypothyroidism, happens in the level of the thyroid gland, it's called primary hyperthyroidism for too high and primary hypothyroidism for too low. That's the way most doctors look at thyroid tests and interpret them. What that fails to recognize is that sometimes the problem is in the brain, and that's called secondary or tertiary. If it's at the level of the pituitary in the brain, it's secondary, and if it's at the level of the hypothalamus or higher, it's called tertiary. The reason that's important is that they have somewhat opposite and differing effects on what the tests look like, and they may look like hyperthyroidism when it's actually hypo, or hypo when it's actually hyper, if you're just looking at the TSH and you don't check the other hormones. Primary thyroid problems happen at the level of the thyroid gland itself. Primary hypothyroidism is one of the most common conditions we encounter in medical practice. Hypothyroidism usually comes from something called Hashimoto's thyroiditis, after the doctor who discovered that antibodies were attacking the thyroid in an autoimmune fashion and destroying its ability to secrete thyroid hormone. This is the main kind of primary hypothyroidism we see, but nutritional deficiencies and other problems can also cause this. Hyperthyroidism can also be autoimmune, that's called Graves' disease, or you can have a thyroid nodule that doesn't respond to the feedback loops and just keeps putting out more and more thyroid hormone on its own and doesn't recognize or respond to the signals from the pituitary and the hypothalamus. Both of those conditions, primary hyper and primary hypothyroidism, are in the expected direction that we see for thyroid tests, because what we're looking for most of the time is we're looking for the responses we would see as if the condition were primary. But in the back of our mind, we always have to keep in mind that it could be secondary or tertiary. If the problem is in the brain, then the problem is whether the pituitary and the hypothalamus signaling the pituitary send the right signal. If it's secondary, that's a pituitary problem, and if it's tertiary, it's the hypothalamus that sends the signals to the pituitary. So for instance, if the brain just puts out too much TSH, say you have an adenoma or a benign tumor of the brain, and it sends out too much TSH signal, it just keeps sending that signal because the tumor's secreting that, then the thyroid will respond and produce more thyroid hormone. The same thing is true if there's damage to the pituitary. Sometimes after childbirth, people get a condition where they have a hemorrhage into that area, or they have bleeding into the brain that destroys that, or people who've had brain tumors or radiation or damage to the brain, they may lose the ability to secrete TSH. Then they have a secondary tertiary problem in terms of not producing the TSH, and if the signal is not sent to the thyroid, then the thyroid doesn't know to make thyroid hormone. TSH is the most commonly measured thyroid hormone. As we discussed, many doctors don't measure anything other than TSH. But for me, that's like looking at a jigsaw puzzle with only one piece. If the puzzle has 5 or 6 or 7 pieces, you get a lot more complete picture of what's actually going on if you put them all together than if you just look at a single piece. TSH has a reference lab range of 0.4 on the low and 4.0 on the high. At Destiny Well, we think the optimal level of TSH is 1.8 to 3.0, with values over 3 representing thyroid function in primary hypothyroidism that is too low. 90 to 95% of the population have a TSH under 3, and so we think it makes sense to be in the range below that. We think a value of under 0.4 is too low, and between 0.5 and 1.7 may also be on the low side. So here's why thyroid functions are so tricky for most people. It's not intuitive, but it is true that an elevated TSH means low thyroid function in primary hypothyroidism at the level of the thyroid gland. TSH is the signal from the brain to the thyroid gland to make more thyroid hormones. In the most common condition, the primary hypothyroidism that occurs from Hashimoto's thyroiditis, where the gland is attacked by autoimmune disease, or other conditions at the level of the thyroid gland, where the thyroid is not making adequate hormone, then the brain says, I'm not receiving enough thyroid hormone, I should put out the stimulating hormone, the TSH, to tell the thyroid gland to make more. So while intuitively we think, oh, TSH is the main thyroid test, if it's high, that must mean my thyroid function's high. The opposite is true. It means the signal to make more thyroid hormone is high, and that happens in the setting of hypothyroidism or low thyroid function. So just remember, high TSH means low thyroid function, means hypothyroidism most of the time, because most thyroid problems happen at the level of the thyroid gland, and that's the way the brain responds, and we're measuring the brain response with a TSH. IgE, immunoglobulin E. There are several different classes of immunoglobulins, and IgE is associated with allergic problems. It's a marker for allergic disease, like chronic nasal congestion and sinusitis, and also for lower chest problems like asthma. And it can go up if you have food allergies or skin conditions. So IgE is something that's important to check if you have chronic headaches, because sinus and allergic problems can contribute to headaches in a number of different ways. IgE is a memory molecule. The cells that produce it have a forever memory. Once you're IgE sensitized to something, you'll be allergic to it for years and years, if not for the rest of your life. IgE reactions are easy to identify. They're quick onset. The severe end is things like anaphylactic shock, but asthma, throat swelling, rashes, hives, and other symptoms also can come on within minutes to hours after exposure to the substance, whether you eat it or breathe it or touch it. There's a well-defined and well-understood mechanism, and it's easy to diagnose by standard testing. Non-IgE reactions are a little bit harder to sort out. They often have a delayed onset of hours to days. They may cause symptoms like GI problems like nausea, vomiting, diarrhea, or skin conditions like eczema. The mechanism is less clear, but appears to be dependent upon the innate immune system, and testing is trickier and less well-defined. However, there are tests of the innate immune system that go along with non-IgE mediated reactions. Serum IgE is measured with a blood test. The reference range is from 0 to 300 international units per milliliter. Generally, being in the lower half of this is in the optimal range. 151 to 300 is mildly elevated, and values over 300 are considered to be elevated. It's possible to get up into the range of 1,000 or more if you have significant allergies, hay fever, a strong family history of allergic problems. It also goes up with air pollution. What's included in the Destiny Well migraine profile? There's the TSH thyroid test, the ferritin iron test, a vitamin D level, an hsCRP inflammation marker, and an IgE antibody level. This test can be of value because it checks for trophic factors, things that support cellular function and the nervous system, like vitamin D levels and thyroid. It looks for essential nutrients like iron that's critical for oxygen metabolism. And other neurologic problems like restless leg syndrome, in addition to migraines, often get better if the ferritin level is normalized. It's an inflammatory screen using the hsCRP sensitive marker, and it also screens for allergic responses for things like sinus problems that can also trigger migraines using an IgE level. All these together provide a fairly comprehensive overview of migraine. And when combined with some of our other panels, like the celiac panel and the anemia panel, they give a broad-ranging view of what kinds of things can cause migraine that are easily fixable. At Destiny Well, we've been extremely fortunate to find some amazingly good coaches, people with backgrounds of success in varied fields who bring all sorts of resources and talent and skill to help you. These folks have many years of clinical experience, and they know how to be of assistance at every step of the way, from motivation to connecting you with the right resources to finding things that you need to get you on your journey. To learn more, go to destinywell.com/coaching to meet our team and find out how they can be of service to you.